I was recently asked by a listener to discuss chronic pain and ways to cope. Living with chronic pain can feel like an overwhelming and isolating experience, affecting not just your body, but your mind and spirit as well. It's important to acknowledge that chronic pain is not just a physical sensation. It often impacts every aspect of your life, from your mood and energy to your relationships and sense of hope. And that's precisely why we're going to talk about it today. Welcome back to Savvy Psychologist. I'm your host, Dr. Monica Johnson. Every week on this show, I'll help you face life's challenges with evidence-based approaches, a sympathetic ear, and zero judgment. Chronic pain is pain that lasts for an extended period, typically defined as persisting for 12 weeks or more, despite treatment or resolution of the initial injury or condition that caused it. Unlike acute pain, which is a direct response to a specific injury or illness and resolves as the body heals, chronic pain can continue even after the initial cause has been addressed. It often affects a person's physical, emotional, and mental well-being. Chronic pain can stem from various sources, including injury or trauma, so an injury that heals but the pain persists. There's also medical conditions, so conditions like arthritis, fibromyalgia, or nerve damage. You can also have post-surgical pain. So this is pain that continues long after surgery is over. And then lastly, nerve damage. So this can be due to conditions like diabetes or certain infections. Common types of chronic pain include lower back pain, headaches or migraines, arthritic pain, neuropathic pain, which is another way of saying nerve pain, and fibromyalgia pain. Chronic pain is complex as it affects people differently. It can lead to emotional issues such as depression, anxiety, and difficulty sleeping, which in turn can exacerbate pain. Managing chronic pain often involves a combination of medications, physical therapy, lifestyle changes, and sometimes psychological support. Psychological strategies are an important part of managing chronic pain because they help reduce the emotional and mental burden, which in turn can help decrease the perception of pain. These strategies aim to change how individuals perceive, cope with, and react to pain. So, I'm going to mention a few psychological approaches that can improve both chronic pain and mental health. The first is cognitive behavioral therapy, or CBT. CBT is one of the most widely used psychological therapies for managing chronic pain. It helps individuals identify and challenge unhelpful thoughts and behaviors related to pain and replace them with healthier coping strategies. Key components of CBT for chronic pain include: one, cognitive restructuring. So this is changing negative or distorted thoughts about pain. So for example, if you're having a thought like, my life is over because of pain, we would want to modify that to more balanced or realistic thoughts. There's also behavioral activation. So encouraging patients to engage in activities they enjoy or can manage, which helps counteract depression and avoid the trap of inactivity, which can worsen pain. The next thing I'll mention is goal setting. So setting realistic and manageable goals for pain management and quality of life. CBT has been shown to reduce the emotional impact of pain and help people regain a sense of control over their lives. When I was a psychologist working in primary care, I often used CBT for chronic pain and found it to be effective. Patients would over time change their relationship with their chronic pain. And the combination of engaging in behavioral activation, they would reclaim their lives in familiar and sometimes new ways. It's great because they learned over time that they could have a fulfilling life despite chronic pain. The second technique is mindfulness-based stress reduction. Mindfulness-based practices are effective in helping individuals reduce the emotional reactivity and stress associated with chronic pain. Mindfulness-based interventions teach people to observe their thoughts and bodily sensations without judgment, which can help reduce pain perception and improve emotional regulation. Here are a few of the key techniques within mindfulness-based interventions. The first is mindful breathing. So, this is focusing on the breath to anchor attention and reduce tension. There's also body scanned meditations. So, bringing awareness to different parts of the body, observing sensations without attempting to change them, and also acceptance of pain. So, learning to accept pain without fighting it, which can paradoxically reduce the intensity of the pain experience. Mindfulness based stress reduction is beneficial because it shifts focus away from pain and distress, reducing anxiety and increasing emotional resilience. The third thing I'll mention is relaxation techniques. Relaxation techniques aim to reduce muscle tension and calm the mind, which can both lower pain perception and improve emotional well being. Common techniques included here are progressive muscle relaxation. So, this is where you systematically tense and then relax different muscle groups to release tension. Another strategy here is guided imagery. So, using mental images to focus the mind away from pain. So, you might imagine peaceful or calming scenarios. There's also deep breathing exercises. So, this is where you focus on slow, deep breathing to activate the parasympathetic nerve system, which will reduce stress and anxiety. These strategies promote a state of calm, which can make it easier to cope with chronic pain. If you're struggling in these ways, know that your pain is valid and that you're not alone. Managing chronic pain requires courage and resilience. And while the journey can be challenging, there are compassionate ways to support your mental health and reclaim a sense of control and peace in your life. What is one thing that you're going to do to take care of your body today? Let me know. You can contact me via Instagram at KindMindPsych or via my email at psychologist@quickanddirtytips.com. The Savvy Psychologist is a Quick and Dirty Tips podcast. It's audio engineered by Steve Rickyberg, with script editing by Brandon Getchis. Our podcast and advertising operations specialist is Morgan Christensen. Our digital operations specialist is Holly Hutchings. And our marketing and publicity associate is Davina Tomlin. Nathaniel Hoops is our marketing contractor. Follow Savvy Psychologist on Apple Podcasts, Spotify, or wherever you listen to podcasts. That's all for this episode of Savvy Psychologist. Thanks for listening, and I'll see you next week.